Hi, my name is Heather Herndon, and here's my presentation on my journey as a nurse leader. To talk about my future, though, I feel like I first need to tell you about my past. So I started as a nursing assistant when I was 18 years old in long-term care. I then became a licensed practical nurse 17 years ago, and then 11 years ago I completed my associate's degree in nursing. I primarily worked in long-term care, but had various roles that include nurse manager, staff education, and minimum data set coordinator. I've worked in the hospital a few times on a cardiovascular thoracic unit, and I learned a lot there, but I always found my way back to long-term care. Nursing should be thought of as more than just a job. It should be a passion and a career choice. With this thinking, you want to advance your education to better fit what your career goals are. It could be administration, research, education, or you may want to be bedside nurse. The possibilities are endless. You should always practice to your full extent of your education. You need to have the direction to accomplish your career goals. Otherwise, you could spend a lot of time wandering from job to job without any goals in mind. Goals need to have a realistic time frame. If you put an unrealistic time frame on it, you can get frustrated. You need to manage your own career. You cannot wait for your employer or a manager to do it for you. If your career goal requires you to further your education or even work in a different organization, it's up to you to set that into motion. Choosing the area you want to work is important, and understanding the trends in nursing is important to know where it needs to be. The United States Department of Labor Bureau of Labor Statistics says that 90% of nurses work in these areas. Listed are the percent of RNs working in these areas. 60% are working in hospitals, either state, local, or private. 18% are working in ambulatory healthcare services. 7% are working in nursing and residential care facilities. 5% works for the government, and 3% work in education services, either state, local, or private. Although there's a nursing shortage at this time, it's expected to ease up, although the demand for higher educated nurses with a bachelor's, master's, or doctorate degree is anticipated to increase. Choosing a career track includes the development of expertise in the patient care area. Education advancement is often required for those areas of specialty. These are a few options with a master's degree or a doctorate. Identifying what your career goals are and then seeing what it takes to get there to go can help you get on the right path. So you could be a nurse leader, a nurse educator, a nurse practitioner, a nurse administrator, a midwife, clinical practice, do research, leadership practice. The possibilities are endless. My end goal is to be a licensed nursing home administrator. And before I started back to school, I knew that's what I wanted my goal to be. And I knew you had to at least have a bachelor's degree. But I decided if I was going to go back to school, I was going to go forward and just get my master's degree. The second requirement is to have 6 months of management of personnel, budget preparation, financial management, and public relations. Or you can bypass this with a 6-month preceptor or internship as part of the long-term care or other related field. And finally, you have to pass the National Association of Long-Term Care Administration Boards, or the NAB. It's important to develop a professional relationship as a nurse. Nurses need to be proactive in developing relationships within different healthcare disciplines. This can help you better solve problems when they arise by getting different colleagues' perspectives on the situation. Your encounters with colleagues need to be purposeful, though. Time is often limited, and to accomplish work efficiently, unplanned and unorganized encounters can affect the productivity. Professional relationships need to serve a purpose. If your colleague moves to a different location or your goals change and your values, you need to no longer have that relationship. Relationships with those who are unreliable and have little respect for others, those relationships should be avoided altogether. Advancing your career is often based on performance with an organization. Performance evaluations have gotten more in depth. The professional nurse's portfolio should include contributions that are made. This includes contributions to patient outcomes, collaborations with the interdisciplinary team, and practices that are evidence-based. This also includes contributions made in coaching colleagues in different situations and outcomes. Being on committees within the organization that contribute to the bettering the organization or the communities is also another avenue you need to look at. Maintaining continuing education requirements for your nursing license, those that are required for your organization, is important when seeking advancement in your career, as well as those that are not required but can be related to your area of specialty. This includes certifications, which we'll talk about in the next slide. Assessing your personal life and your work balance is needed to set goals. There needs to be a new goal every year within your professional work. Doing this can help you seek out the support you need in accomplishing those goals. So studies have show that certifications can lead to improved patient outcomes and create positive work environments. Nurses who are certified often get promoted more rapidly and have more advancement opportunities and feel accomplished. Patients and families want to have confidence in their nurse, and the certificate can confirm that with the family and the patient that the nurse is caring for them and is a highly trained professional and is competent. This can also make you more desirable to employers. It also has been found to lead to better job satisfaction and decreased turnover in the workplace. When a nurse is certified, this gives them more confidence when making decisions because their knowledge has been validated and they feel they know they have the skills to make the decisions and choices they need to in their profession. Nurses who are certified are more likely to be promoted and have a better compensation as well. Studies show that certification can lead to improved patient outcomes and create a positive work environment. Nurses who are certified are often promoted more rapidly and have advancement opportunities and feel accomplished. I'm currently a certified MDS nurse coordinator, and I plan to keep this as I transition to my new career, as a nursing home administrator. The MDS assessment drives the reimbursement in the long-term care facility, and it is also where the quality measures are pulled from. Keeping this certification will help me keep up with the changes within the reimbursement world and changes in the quality measures within the facility, and as well as the way if there's any changes in the way they're measured. The nurse executive certificate will also be beneficial. This certificate can be obtained following 2,000 hours of leadership or management role that is responsible for the day-to-day operations and outcomes of a department or a unit. Joining nursing organizations has many benefits as well. You can get discounts on certifications and continuing educations. You're able to stay up on the latest nursing news, and you're able to connect with other nursing professionals for advanced support. Being a member of an organization gives you a voice to policymakers also, so you can give your thoughts to them. It's also a way to do webinars and other developmental resources to further your education in your field. Here are some organizations that I plan to join when I'm finished with school. The American Nursing Association, American Organizations for Nurse Leadership, and American Organization for Nurse Executives. And before we can take care of others, us as nurses need to take care of ourselves. Not caring for ourselves can be dangerous, and it can lead to unhealthy and de-energized work environments. When we don't take care of ourselves, it can put us nurses in an extreme state of tension and suffering and preoccupation with those who we've taken care of. Rest, tranquility, and stress management are essential Some self-care ideas to get enough exercise and maintain a healthy diet. We need to take time for ourselves and not always put others first. Learning to say no is something I've been working on. I would often feel that I would let someone down if I told them no to an extra shift, no to going and hanging out with my friends. But I found out if they really care about me, they're okay with me and they understand when I say no, that I have to take time for myself. Another is working on avoiding negative people. Being around negative people can cause stress in your life. Nobody needs extra stress. And last, it's important to take time to just plan rather than just do. This gives you extra stress as well if you're not planning out what you're doing next. A way for nurse leaders to give back is to be a mentor. A mentor provides leadership to a mentee and is a relationship between nurses at the beginning of their career, and a change of position, or when a nurse is advancing their education. The mentor provides guidance and coaching a nurse with less experience. The mentor can also provide counseling for career management to the mentee and what the next steps are in obtaining their goal. Being a mentor requires time and patience because this is a long-term relationship. There are many benefits to mentoring someone. Here's just a few of them here. It can increase nurse readiness for their next steps in their career. It can improve nurse retention. It can help with self-confidence of the new nurse or in their new role. It helps with the mentee build relationships within the healthcare organization. Also can help with their networking ability in the future. So it helps both you and the mentee. So let's look back at everything. It's important to set goals so that we do not wander through our careers aimlessly. Make a plan and take initiative for our own goals. We can't rely on someone else to advance our careers for us. We need to take action, whether continuing our education, obtaining certificates to reach the next level in our careers. Never stop learning and growing as a nurse or a leader. We need to take the time for ourselves and learn to say no and to avoid negative people. And finally, give back. Being a mentor to someone in their career path, help guide them to the next step and become a successful leader. Thank you. Here's my references that I used.